Good afternoon. Welcome to the St. Clair County EMA office for our weekly COVID briefing. I'm here today with County Board Chairman Mark Kern and the Director of the County Health Department, Mila Blanford. Mila, you have today's numbers for us.
I do. Thanks, Brian. Good afternoon, everybody. For the reporting period of September the 2nd to September the 8th, we have a total of 657 new positive tests out of 9,340 tested in that reporting period. The age range of these individuals is under 10 to in their 80s. The weekly county positivity rate is at 7%, with the match of the 7-day average at 7%. Regionally, the county positivity rate as of September the 5th was at 6.5%. Unfortunately, we have 4 new deaths to announce today. We have a male in his 50s and a female in her 50s with known health conditions. We also have 2 males, one in their 70s and one in their 80s with unknown health conditions. Countywide, we have conducted a total of 445,311 tests, consisting of 37,799 positives and 407,512 negatives. Total number of deaths to date is 518, and our condolences go out to those families. To date, the number of individuals who have completed their 10-day isolation period is at 36,278. Statewide, we have conducted a total of 29,549,827 tests, consisting of 1,554,336 tests. That's an increase of 26,216 from last week. Total deaths to date is 24,194, which is an increase of 215 from last week. For St. Clair County hospitalization numbers, the number of COVID-related hospitalized patients in St. Clair County hospitals is at 55. Regionally, we're at 121. Number of patients on ventilators in St. Clair County hospitals is 3. Regionally, we're at 13. Randy, do you want to share that graphic? So again, our hospitals have been able to share a graphic that shows us the number of patients in St. Clair County Hospital with COVID-like illness. You can see in the first one, there's 55 hospitalized. Out of that, 51 are unvaccinated, or about 93%. We have 12 in the ICU, 2 are vaccinated, 10 unvaccinated. So that's about 83% that are unvaccinated. 3 on ventilators, 0 of which were vaccinated. Okay, thank you, Randy. Okay, we'll move on to congregate care, announcing those in outbreak status with new cases. Caseyville Nursing and Rehab, 1 new case. Cedar Ridge of Lebanon, 2 new cases. Cedarhurst of Shiloh, 2 new cases. 4 Fountains, 1 new case. Gateway, 2 new cases. Mercy Rehab and Care Swansea, 1 new case. Parkway Gardens, 2 new cases. And Sycamore Village in Swansea, 1 new case. Randy, do you want to show the age breakdown as well? So we've done in past weeks, we want to show the age distribution of our positive cases. Right now we have 55% of those are under the age of 40, 28% are under the age of 20, and just under 14% are under the age of 10. So over time we can see that we have had that decrease, the ages affecting the younger age groups. And we know the Delta variant is still about 80% here in the county, and the Alpha is about 20%. So that's what we expect. That continues what we've seen in the following weeks or the past weeks. Our case rate here in St. Clair County is still high transmission rate. It has dropped a little bit. We're about 167 per 100,000, and it has been as high as 266. So we have seen a little bit of improvement there, but overall, the numbers aren't where they need to be. We offer testing Monday, Wednesday, Friday, and Saturday at St. Clair Square Mall from 8 to 4. They also offer all 3 vaccine options there, as well as 330 West Main. We offer vaccine Monday through Saturday. Monday through Friday is 10 to 6. Saturday is 8 to 4. If you need any assistance, you can call the health department Monday through Friday from 8:30 to 3:30 at 825-4447. We do offer that 3rd dose for those who are immunocompromised, either moderately or substantially. And our healthcare professionals can talk to you about that when you arrive. You can drive up. You do not need an appointment. But if you'd like to have an appointment, you can register online at our Facebook or our website. Okay, Chairman Kern?
So, Mila, I noticed half the deaths this time were from a female in the 50s, male in the 50s. So not only are we seeing a younger population affected by COVID or infected by COVID, but we're now seeing that age group starting to be part of the death population.
Correct, as we've seen the shift with the positivity in the younger age groups as well.
So that leads us then into, with people who are vaccinated now needing this booster shot, I know you're working with Herb Simmons and Brian and Randy, and we're trying to maybe replicate what we did before.
Right.
So we're potentially looking at the fairgrounds. We've been surveying it and working with the fairgrounds people. It's not announced for sure yet, but we're going to try to do booster shots there.
Correct.
What's the timeline on that? And will that be Pfizer?
It'll be both. As of right now, they expect around September 20th that booster shot will be approved for all age groups. Right now that would be for Pfizer. And so we hope to offer a mass vax style clinic. We're looking at the fairgrounds as an option, but there'll be more information to come on that in coming weeks.
Okay, great. I appreciate that. I think that was successful to give the original vaccinations.
Right.
So being able to offer boosters in a setting where you stay in your car, where it's a quick, easy process, if we can do it again, that would be great.
Sure. People seem to like that drive-up option like we have at 330 West Main. So we'll like to visit that again for those booster shots in the future. There's not a definitive date on that. We're still waiting to see what's approved. But as of right now, they're saying around September 20th, and that will be a third dose administered 8 months after your second dose that you received.
Great. Thank you, Mila. All right. Well, let's take a look at zip codes for today. 62059, we're up 253. And remember, these are the COVID positives that we've added in the past week in these particular St. Clair County zip codes. 62201 is up 14 to 768. 62203 up 25 to 858. 62204, you're up 13 today to 566. 62205 up 19 to 886. 62206 up 30 to 1880. 62207 up 20 to 893. 62208 up 42 to 2,172 or 73. 62220 up 36 to 2,702. 62221 up 54 to 3,588. 62223 up 34 to 2,290. 62225 up 4 to 224. 62226 up 60 to 4,086. 62232 up 20 to 1,106. 62239 up 11 to 619. 62240 up 4 to 220. 62243 up 25 today to 924. 62254 up 3 to 941. 62255 up 7 to 125. 62257 up 4 to 437. 62258 up 14 to 1,385. 62260 up 3 to 934. 62264 up 20 to 457. 62269 up 66 to 4,192. 62282 up 3 to 82. 62285 up 11 to 692. And finally, 62289 up 1 to 59. So today, every zip code had a positive uptick, which is not where we want to be. But from the last week, we're down. The regional positivity is down to 6.5% today from 8.6% last week. So that is headed in the right direction. But the 7-day rolling average is exactly the same as it was last week at 7. So, Brian, I think the news is a little better this week, but Labor Day enters into this. And I know Herb Simmons, who's in the other room conducting COVID business, would tell us, let's be vigilant. And this weekend, we're probably going to see an uptick from Labor Day, just knowing how the numbers performed for us last year at this time.
Based on what we've seen in the past, we would definitely expect over the next week to week and a half that we're going to see some additional increases. And then unfortunately, when we see those additional increases, 2 to 3 weeks down the road is when we see the hospitalizations and unfortunately some of the deaths that come with those. We're still seeing good positive information as it relates to the vaccines. As you saw the chart from the hospitals earlier, a good majority of those that are in the hospital are unvaccinated. So it's showing the vaccine is helping. We know the vaccine is not 100%. There are people that are vaccinated that do get severely ill from COVID, and it is unfortunate that does happen. But the vaccine is the best avenue that we have to help people move through this.
As part of a combination of things. So wear your mask. It's good common sense. Mm-hmm. You continue to wash your hands. You try to avoid close places where the spread can happen, because the Delta variant is a virulent strain. Mm-hmm. And then that vaccine, that is the real measure of trying to get this virus out of our community. Get vaccinated. It's proven. It is now FDA approved for Pfizer. Hundreds of millions of doses have been given, so we encourage everybody, get that vaccine.
Absolutely. Mila, a couple questions that came in today. A person asked, can they get the Pfizer booster if they originally received the Johnson & Johnson shot?
No.
Okay. Another person said, what will the wait times be like after for a booster shot? Is that the same, or?
So for the booster, it's 8 months after your second dose.
But the wait time so after they get the shot, how long will they have to wait at the facility? The monitoring
the 15
time.
to 30 minutes. So most people have a 15-minute monitoring period, and then some have a 30, depending on what their health history is.
So based on what the wait time they experienced on their first doses,
correct,
the booster would be the same.
Yes.
Okay.
Unless your health history has changed.
Correct. Well, that's all we have for today. We thank you for joining us here for another weekly update from St. Clair County EMA and the Health Department. We'll be back with you next Wednesday with another update, unless something comes out sooner, and then we'll be back with you to give you more updates. We thank you for joining us.